Good afternoon, sisters and brothers. Thank you again for joining us for, well, what is now a special edition of First Friday Wellness Webinar. Usually we do them at the first Friday of every month, as the name suggests. But of course, this month things were in flux due to the rate increases, which I'm sure you've heard about, and more we'll discuss in more detail in a moment. But quickly, the Healthcare Ombudsperson's program is something that CWA negotiated in our current contract to give members a place at the local where they can have someone who's focused solely on their healthcare needs and are able to answer the healthcare questions, help you walk through the process that from enrollment to denials to appeals and so on and so forth. And part of that process, the reason we have this program is also to make members more better healthcare consumers and more conscious consumers of the healthcare, right? Many of us, we just pay our copay and we don't think about the cost that's associated. But if you've been on some of these webinars before, we talk about those costs associated with a variety of treatments, a variety of procedures, and that there are alternatives and better, actually, higher quality alternatives at a lower price, maybe not to the copay, but the overall plan. And why that's important is, while we're just paying copays here, for the most part, our premiums are pretty stable, due to in large part, great negotiation on behalf from our bargaining team, and more will get more into the minutia of that in a moment. There's still a cost to the state, right? And the state bears out all those costs, and at the end of the day, we're still taxpayers here in New Jersey. So at some level, we can always say that these costs exist on us. But also, when more money is being pumped into healthcare year over year, right? There's less money on the table for other things. Primarily we're talking about our salaries, but then other programs that we may be interested in, both as state workers and as residents, right? And more, we'll talk a little bit more about the premium and why we reject those numbers and whatnot in a moment. But after more goes over the premium rate increase, the agreement we came, and the agreement is due, to the members mobilizing, whether it's making phone calls to the governor's office or calling the treasurer and showing up to that rally in Trenton. And if you did that, we thank you for joining us and helping us get that agreement. Once more covers those things, conscious consumer here, I will go over the plan designs that are available to you as members of CWA that you can take a look prior to open enrollment, which starts tomorrow, and see if you need to make a change. And I'll also go over some wellness programs that are available to you as we wrap up. With that, more, if you want to jump right into it.
Sure. So, thank you, Abdul. I'm gonna run through this quickly. We covered this in depth during a special meeting on healthcare, the healthcare changes, and the memorandum of agreement on these changes. And then also we covered at the last membership meeting. If you would like more information about this, I will drop a link in the chat to our website where we have resources for you to see. You can take a look at the MOA directly. Also resources and charts where explaining what the increase means to you and actually finding what your salary, the type of plan you have, and what the changes will mean in real dollars to you and your family. So just a quick synopsis of what happened. Sometime around July, the state released numbers on what their consultant named Aon believed how much the premium should increase by, and they came with numbers in saying 20 to 24% increase in premiums. Now we know that we pay a percentage of salary, but in our contract we do have language where if the premiums go up a certain amount, there is this thing called an escalator clause that escalates the percentage of salary. However, it does force the state to the bargaining table. So we saw Aon's assumptions as to what the premium should be. We did not agree with it. We pushed back on their numbers. We, pushed back on the state, saying that the numbers weren't correct, that the numbers were based on a very, very specific, unique situation, which was a year where people had put off certain medical procedures due to COVID, and then a year where people got those medical procedures. So there was an inflated cost, but that was due to what was called a COVID, almost like a COVID bump. And we thought that was a very unique year. It was very atypical, and it wasn't something that we would see going forward. So because of the strong language in our contract that we negotiated back in 2019, we were able to force the state with other state worker unions back to the bargaining table to discuss healthcare. They had come to us with a increase of 18%, and we had said no, that it's too much for our members to bear. This is not appropriate. And there's also money that was available through the federal government, the ARP, the American Rescue Plan, and it was used specifically for that COVID-related healthcare costs. Was one part of the ARP. So we got to the table. The state workers negotiated, and what we negotiated was a 3% increase in not in salary, but in a 3% increase to what our members are paying. So currently members, because we got off of Chapter 78, the last contract, our members are paying a percentage of salary. And I'll explain this briefly, but our members are paying a percentage of salary, and the 3% increase would be a 3% increase of the percent, not a 3% increase of a 3% more of salary to be paid to the towards healthcare. What that means is if you were paying 4.5% of your salary for healthcare, a 3% increase would be 4.64%. So the one example is a worker making approximately $59,000 a year would go from paying 4.5% of salary to 4.64% of salary, which is the equivalent of about $80 annually. That's what we're able to negotiate versus a full 18% increase, which would have been about a $480 increase annually. So we were able to negotiate that change. The only that change from the 18% to the 3%. The only way we were able to do this was because we had members mobilize and members take action. So if you made a phone call to the governor's office, if you made a phone call to the state treasurer's office, if you came out to the rally on September 13th, thank you. And all your coworkers should thank you, because it was that mobilization and that action that got us over the top to get us an agreement that protected our high quality healthcare and kept the employee and our member contributions low compared to what they could have been. With that, there were also some plan design changes that we had to agree to. I'm going to be clear, no one's happy about this. No one thinks that no one wants to do this, but this was in order to get an agreement. It is a give and take. So we're able to keep the increase in premiums very low and nominal. The example I gave, it works out to be approximately $3 a pay period more that person in that scenario would pay. But what we did have to do is we did have to increase copays in two areas. And this is the only plan design changes that we had. It was a $15 increase in specialist copay. So it went from $15 to $30. But that does not include OBGYN. We got to carve out for OBGYN because for many women, that going to your OBGYN is basically the same as going to a primary care doctor, and women's health care is so critically important. And we want to make sure that that aspect of healthcare was not affected. The other increase was to urgent care. Urgent care went from $15 to $45. But Abdul is going to talk about an option that could help mitigate those costs for many of our members. And I'll leave that to Abdul to discuss. So this was the agreement. Again, I know Karina just dropped the links in the chat. So please visit our website, go to those links. If you have questions, please contact your staff rep at the local. But that's a quick summary of what happened over the summer. And just so folks know, these changes will take effect in the new plan year, which begins in January or the first full pay period of the new year, which I might start a couple of days before January. But now I'd like to turn it over to Abdul. Abdul can explain the state health benefits program, plan options available to you, and some other really important programs and wellness programs that are available to our members. So Abdul, please, floor is yours.
Thank you, Mauro. As tomorrow does begin open enrollment and it lasts through the month of October, this is a good time for everyone to really take a look at the plans that are available to you, see how you engage in your benefits the prior year, see what may be, what's best for your family. Of course, many of our members are in the CW Unity plan. Prior to that, they were in the NJ Direct 15 plan. Clearly the most popular plans we have, and they're really great benefits, premier benefits, but there may always be a better option, right? Or a same quality, lower cost option, right? And excuse me, I just want to remind folks every open enrollment, take a look at it, see if there's something better for you and your family, right? Jumping right into it, we know the state health benefit program is comprised of 3 parts: medical and prescription drugs, which are tied together. You enroll in one, you enroll in both, and the dental plan, which is a separate enrollment. It's available to you, the worker, your spouse, and still the unit domestic partner if you have any eligible admitted children that you may have. Looking at plan design, this is an old chart. I just want to preface that it does not include the increases that Maura just mentioned. I will highlight those increases again as we go through the chart. The one thing I want to flag right off the top is when it comes to the HMO and high deductible plans off to the right, if you are in one of these plans during open enrollment, sometime in October, early on, preferably, I would like you to reach out to the local, reach out to me. I would like to have a conversation about why why you and your family are in these plans, and to make sure it is the best plan for you. I'm not saying it's not, but I do want to make sure that's the case. For example, I'll tell you, broadly speaking, across the country, an HMO plan is inferior to PPO plans, which the rest of the plans are. That's the way it is. Variety of reasons include having to be required to have a primary care doctor that acts as the gatekeeper, right? You want to see a specialist, you need a referral from your primary care doctor, right? Also, you can see at the bottom, there is no out-of-network coverages, right? So we just want to ensure that if you're in these plans, we're speaking about it. And the main thing with HMO is, which is why for the average worker, I would not recommend the HMO plan beyond the product deficiencies in comparison to the Unity plan. You are most likely going to be paying more for it. Now, we know we had a bunch of folks jump into the HMO during the Chapter 78 years when we're paying, these high costs for healthcare. But due to negotiations in 2019, we pay, as Maura mentioned, a percentage of our salaries for Unity, right? And Omnia. But HMO and the high deductible plans, we pay a percentage of the actual premium, right? So if you're actually in these plans, your plans are actually going up every year, year over year, where the other folks, we're not seeing those same increases, right? When you're paying a percentage of the premium goes up, no matter what, you are going to see that increase. And so at every single, almost every single salary level we have, you will find that the HMO actually costs more than a Unity Direct plan. And there's really no reason any of us should be paying more money for an inferior product. But getting into the Unity plan, we see that the copay is $15 for primary care. It is currently $15 for specialists, but as Maura mentioned, that's going to be increased at $30. We see the emergency room copay is up to $150. There's a in-network deductible if you were hired after 2019, right? And then so on and so forth. You can see this Unity Direct plan has nationwide coverage, both in and out of network benefits. Whereas again, we pay a percentage of our salary. You have the Omnia plan, which is a 2-tiered plan, right? You don't pick your tier. Rather, Horizon has determined that their network of doctors, hospitals either fall in tier 1 or tier 2. And so some of the benefits of the plan include, if your doctors are in tier 1, you'll notice you pay a smaller copay, $5, not $15. But if you're in tier 2, you pay $20, not $15, right? So keep that in mind. Again, specialist copayment is going up. Rather than $15, it will be, for tier 1, it'll be $30, and tier 2 will be $45. And you can see it has a lower ER copay, but I do want to flag this $1,500 in-network deductible. That is not for every office visit, but for certain procedures, certain things like hospitals and whatnot. You would have to pay this $1,500 deductible if you're going to a tier 2 facility. You will also notice, like an HMO, there is no out-of-network benefits, right? The idea here is the state is trying to de-incentivize the use of out-of-network doctors and providers, mainly because it's a huge cost driver. Granted, very little people in the state health benefit plan use out-of-network services frequently. It is actually the single largest cost driver to the plan, right? So the idea here is to not use out-of-network services. And I mentioned earlier about being a conscious consumer, a better healthcare consumer, and how that affects us. And this is one of the ways, right? Consistently being out-of-network, regardless if the plan pays it or not, is overall more costly to both you and the state, which again is costly to you, right? We discussed that earlier. So why would anyone join Omnia? One, the premium is 25% less than the premium of the Union Direct. So whatever you're paying for Union Direct out of your paycheck, you'd be paying 25% less. So for example, I'm in Omnia, I'm paying roughly $1,100 less a year to be in Omnia, right? So it's a substantial amount of money to be saved. Number two, if you enroll in the Omnia for one full plan year, that first year, the state of New Jersey will give you a $1,000 gift card. So they are heavily incentivizing folks to join this plan as well. And so while most of us are in CW Unity, we love CW Unity, you should stay in CW Unity. I do recommend folks take a look at their benefits, see if there's not a better option, such as Omnia. Again, if you're in the HMO or the high deductible plans, please contact me. Let's discuss it. And let's not see if there's a better plan for you. There's no changes to anything related to dental, but just to quickly go over it. There are two main types of plans. There's the dental expense plan, which is Aetna is the sole carrier for that plan. And then there's the dental plan organization, or DPO, pretty much the HMO of dental health. HealthPlex, Horizon Dental Choice, Aetna, DPO, MetLife, and Cigna Dental Health all are the carriers for these plans. If you go into Benefit Solver, you will see the list of plans as well as their respective bi-weekly contributions, right? Regardless of which DPO plan you have, it's the exact same plan, just covered by different entities with different premiums, different contributions from you, but the cost out-of-pocket cost and what's covered is the exact same. So, but between the two types of plans, you will see on the chart, the expense plan has both in and out-of-network coverage, where the DPO plan does not. The expense plan has a very small deductible, where the DPO does not. The expense plan works off of a co-insurance model, where the DPO plan works off a co-payment model. The expense plan has a annual maximum benefit, where there is no maximum benefit for the DPO plans. Expense plans, again, in and out of network, you also can pretty much choose your dentist. Granted, if it's in network, you have to choose a participating dentist, but DPO plans are a little more restrictive. You must choose a DPO participating dentist. Pretty much, you will get coverage anywhere with the expense plan, though it will cost you more. And DPO plan is a little more restrictive. However, when it comes to orthodontia, you have a teen that needs braces, the DPO plan is more generous of a plan. Again, no changes to prescription drug coverage. Everything remains the same in terms of co-payments, and OptumRx continues to be the pharmacy benefit manager. We're not going to dive too deep in this, as both Maura and myself mentioned earlier. Next Friday, we do invite you guys to come back, join us to hear from the Benefit Solver team directly as they walk us through enrollments, walk us through their system, and get at that firsthand look. Even if you're not planning on making any changes next month, I do urge folks to, one, register for Benefit Solver, and two, join us, because Benefit Solver is what pension benefits and HR is shifting to for everything related to healthcare. So not just new hire enrollments or open enrollments, but folks who go on leave and need to prepay their health benefits. They also will have to go on Benefit Solver and make those payments through that system. And we don't want folks not being aware of that. We don't want them to miss those payments, because it's a lot of trouble to get back your health benefits once they lapse. So even if you have no intention of making any changes, I do urge folks to join us next week to learn about Benefit Solver and how to use it. Now, we have a poll real quick as we start discussing the direct primary care. Basically, it's asking you, and Karina, if you can put it up, if you had to go to the doctor today, right? Not schedule an appointment a week from now, but if you needed to go to the doctor right now, you needed health care, are you going to your primary care doctor, your family doctor? Are you going to go to urgent care, or are you going to the ER? So if everyone could quickly do that poll real quick, and Karina, if you could put up the results once you have them. I'm really hoping folks do say primary care. I'm hoping no one says ER, but we do know, 15, 20 years ago, a lot of people were going to ERs as their primary as their primary method of healthcare. That's one, very costly, and two, not a good way to engage in healthcare, right? But primary care, as it was then and is now, access to quality healthcare. Thankfully, no one's going to the ER. Access to quality primary care is actually pretty low in America broadly, right? There's a shortage of primary care doctors, and so folks have to find other ways, which is why urgent care has popped up in the last decade or so to fill that gap, right, between the ER and the primary care doctors. And so many of us, myself included, you need to see a doctor, you would have to go to urgent care, right? Even if you have a primary care doctor. Well, one, I'm going to say, if you do not have a primary care doctor, I do urge you to get a primary care doctor immediately, right? We know when you have access to a primary care doctor, your overall health is better, your overall wellness in the long term is better. You will pay less for healthcare, the state will pay less for healthcare, and it's just better for individuals, families, and societies to have a primary care doctor. So if you don't have one, please get one. If you have a primary care doctor and you're also still going to urgent care, you should really ask yourself why that is. And so we know some of the reasons that is because in New Jersey, primary care doctors have a census on average of 4,000 patients. So you can imagine they're seeing a lot of patients every single day. And so it's hard to see them. And so when you need care urgently, you go to urgent care, correct? And that's why those are the reasons we negotiated this direct primary care model of healthcare with the state of New Jersey, right? The idea is to give our members access to quality care at a low cost, right? And so the direct primary care facilities, there are several across the state run by either Everside Health or Sanitas Medical Center. You can see there are several coming on board in Toms River and Willingboro and whatnot pretty soon. What is not on here is Fairlawn. Fairlawn is also in November is going to be opening as well. The idea here is you get same day, next day appointments when you need to see your doctor, little to no wait time when you go to the doctor's office. They can provide you with on-site blood work rather than sending you to LabCorp or Quest. They can even dispense, basic medication for some acute illnesses, right? So you're not going to fill a prescription elsewhere for certain prescriptions and whatnot. And there's zero cost to you, the member, right? You're not going to have to pay any membership fees. You're not going to see any additional premiums coming out of your paycheck, and they're not even going to take any copays from you, right? So whether you're normally paying $5, $15, or $20 for your copay at a primary care office, at your primary doctor, no copays at the direct primary care offices. And so again, I urge folks to, even if you have a good primary care doctor, if there's an office near you, give it a try. There's no harm to you to do so. No one's going to ask you to drop your primary care doctor or change things up, but see if it's the right fit for you. We're going to shift gears and discuss the wellness programs and resources available to you as a CWA member. Tons of different resources, discount programs, financial incentives that are all available to you. Once you log into Benefit Solver, you'll see them all in the My New Jersey Benefits Hub. But now I will focus on the NJWell program because October 31st is the deadline to get your 800 points. And so this is definitely the most popular wellness program used by state workers across New Jersey. If you do not know about it, the idea here is you gain 800 points from November 1st to October 31st, and the state will give you a financial incentive. So that you start off by filling out a health assessment online, then you get a biometric screening, lab work, and then you have to do a variety of other activities before October 31st to equal 800 points, and the state will give you a gift card. Most state workers, they get $250, but our members through negotiations get $350. This is also open to your spouse if you have one, so your family can get up to $700 a year. Now, if you are enrolled in direct primary care, you go to Sanitas or you go to Everside, you still have to fill out this online health assessment. When you go for your physical, they'll do the blood work, right? And rather than doing all these other activities, you do a second appointment, which can be virtual. Mine is next week, and they will basically discuss wellness and give you a plan for the year to be a healthy individual. And that is all you need to do to get your 800 points and your gift card. As we wrap up, I do want to provide folks with some behavioral health resources that we have either engaged in directly with members, or we have come across, doing this work. Right off the bat, Horizon has their own in-house referral service available to you. Of course, they'll make sure that whatever provider they're giving you is in network. They also can provide you with a care coordinator that will keep up with you as you engage in mental health services. They also have this Able To app, which basically is a support program to provide you with new tools to help you improve your overall health. Then we have Eleanor Health and Recovery Centers America. These are both facilities here in New Jersey, several different facilities that focus on providing compassionate, evidence-based care for anyone affected by an addiction. Both are inpatient residential treatment facilities. FHE Health and Futures Recovery Health are similar facilities. Both do inpatient care in Florida, but beyond specializing in addictive disorders, they also address other behavioral health diagnoses such as mood disorders, depression, anxiety, and a variety of traumatic disorders. And then not lastly, but we have the Employee Advisory Service, EAS. They provide confidential assessment, counseling, referral service to employees and their dependents. The thing I want to flag about EAS is that while you are certainly free to go to EAS, if you need, assistance, they also work for the employer, right? So HR, your manager contacts you, say, hey, you need to go to EAS. They schedule it for you, or EAS calls you on behalf of HR and says, you have an appointment scheduled with us on this date. We want you to reach out to your staff rep, before going, just to make them aware. Usually we find that if the employer is having you go to EAS, it's one of several things they're checking off on a list that may lead to discipline, and we just want to get ahead of it. And lastly, our new program that the Pension Benefits has contracted with to provide mental health services to our members is Forge Health. As you can see on the screen, pretty much help is here for anyone who needs it. They offer comprehensive mental health and substance use treatment up to, but not including, inpatient care. If you need inpatient care, Forge Health is not able to do so. They are outpatient care, including intensive outpatient programming, right, IOP. But they also give you general counseling for individuals, family, couples. They have special programs for veterans, first responders, LGBTQ individuals. If you are in need of medication, they provide primary psychiatry right there. No need to have a separate psychiatrist. No need to find a separate psychiatrist, but they are focused on therapy as a model for care, right? Not just pushing pills. Excuse me. Certainly, I think is the value added for our members. Like primary care, mental health care is, at a deficit in this country, particularly with pandemic. Lots of folks needing mental health care, and there's not enough doctors to go around. Having access to Forge Health will certainly be beneficial to our members. And so if you have any kind of mental health care needs, if you have any kind of substance use issues, certainly, contact Forge Health at the number provided on the screen, 888-30-FORGE, and we urge you to get the help that you may need. It is, a very good option again. And with that, we will now shift to questions. Mauro, if there's any questions in the chat, let us know.
So there is one question in the chat, and if you have questions, please send them to me in the chat. This is specifically about the flexible spending account. Does unused money go back to the state, or does it stay with the employee?
So FSA, flexible spending account. Yeah, if you don't use the money by the end of the plan year, well, it's not the end of the plan year. I think there's a 3-month grace period into the new plan year. You will lose it. FSA is a use it or lose it program. You do have to enroll every year during open enrollment October 1st. So you kind of need to see, how you engage in benefits the prior year to give yourself a good estimate going forward. I, for example, learned I need to increase my FSA because I used up all my money by June. So yes, it is a use it or lose it program.
No other questions currently in the chat. If there are any questions, please send them to me. But just based on our previous one, some questions I think that are we're good to cover. There was a question about is the direct primary care covered under all the health plans available?
Yeah, that's a good question. That was asked in the last session. No, you must be enrolled in either CWA Unity Direct or Horizon Omnia to enroll in the direct primary care model of healthcare. If you're in the HMO or high deductible plans, you will not have access to it.
And Abdul, if you can maybe speak to folks who are currently in their plans, what, if anything, and they're happy with their plans, they're in the CWA Unity plan, they don't want to change, what, if anything, do they need to do during open enrollment?
If you are happy with your plan, you don't want to make any changes, then there's nothing to do. Literally nothing. Everything will continue on as is in a new plan year. With the caveat that I mentioned with FSA, you do have to do that if you're enrolled in FSA, and folks should be, using FSA to some degree every year. It is a, tax shelter program, but you have to be careful again how much you put in, because use it or lose it. But then you do have to re-up that every year. And again, like I mentioned before, I do urge folks, even if you're not going to make any kind of changes, to become familiar with the benefit solver system. Number one, at some point, I imagine you're going to need to use it. And two, it actually houses a lot of the wellness programs and information wellness programs within it. So it's a one-stop shop, right? I'll tell you, the pension benefits website, pretty confusing at times, information all over the place. Having everything in benefit solver is helpful. And lastly, the My Choice Find Provider tool that we went over, I think 2 months ago, is also housed within benefit solver, and that's a really good tool to use. So I would still urge folks to join us next Friday to become familiar with the program.
And with that, if we could just put the link to register for next week's webinar, if we can get that in the chat.
I guess plug for November, we're going to have an Everside join us, first Friday of November to discuss direct primary care more in depth. And if there's other questions, you want to wrap up, Mauro?
I don't see any other questions. I want to thank everyone for joining us. I do think that these are very helpful. I'm not sure if it'll open, but there's supposed to be a survey that opens at the end of this when we end the meeting. If the survey does open, please take a minute to fill it out. It's important for us to hear from our members if these webinars are helpful, if what we can do better. The only way we can improve is if we hear directly from our members. So please, if the survey does open up, please take the time to fill it out. And with that, I think that is all that we have for this webinar. Again, I want to thank everyone for joining us. I want to thank Abdul for presenting and Karina for hosting this. So with that, there's no other questions. I want to thank everyone for joining us, and enjoy the rest of your Friday and have a nice weekend.